by making sure that we keep hospitalizations down and we make sure that our ICUs are not at capacity. And the way we do that is by making sure that our vaccination rates continue to go up. The circuit breaker restrictions that we put in place 6 weeks ago have accomplished what they set out to do. We've seen these restrictions reduce transmission rates and give our vaccine rollout time to take effect. And the vaccination rollout is what got us to this point in the first place. And if we continue to see vaccinations go up, we'll be able to move to the next stages of the restart faster. But as we move to phase 1 of the official plan, we need to make sure that we have metrics in place so the public understands where we are and where we want to go. Obviously, vaccination rates will be a key part of that, but so will transmission, case counts, as well as hospitalizations. And it's not just about the dates, it's also about the data. The restart plan focuses, of course, on today as step 1, and then subsequent steps as we go through the summer. That will all be guided by case counts, by vaccination rates, by hospitalizations. And Dr. Henry will go into more detail on that in a few moments. But starting today, British Columbia will reopen with a series of 4 steps. And it starts by lifting the circuit breaker restrictions that have been in place for some 6 weeks now. And what does that mean for British Columbians? It means you'll be able to enjoy a meal in a restaurant with some friends. It means you'll be able to have more guests over to your home or have a barbecue tonight in your backyard. It means that travel within your regions will be okay, but we want to stay in those 3 key regions, the island, the rest of British Columbia, and the lower mainland. The observations to stay local have been lifted, but the restrictions on travel have not. We want people to continue to use their common sense, not just in terms of where you travel and how you act, but also being guided by what your impact could be on not just yourself and your family, but others in the community. Businesses today will start with their COVID safety plans in place to operate safely. From the beginning, Dr. Henry, Minister Dix, and I have been making sure that we advise businesses on how best to stay open, not on how we can shut them down. That's got British Columbia through the past 15 months, and it will get us through the next number of months as we go into the summer. The next step of the plan will begin in mid-June, and when we reach that point, recreational travel across the province will be allowed. We'll be able to go out and see a movie or enjoy a sporting event indoors or fitness classes as well. As vaccination coverage continues to go up, we'll be able to have outdoor weddings of up to 50 people. Graduation ceremonies may be possible for those graduating later in the summer. And as more people realize their first and second doses, we'll be able to look at moving to steps 3 and step 4. And we're targeting all of that for step 3 for early July and step 4 for later in the summer. And of course, at that time, we will be able to hold large indoor and outdoor gatherings. We'll be returning to what will be close to normal based on where we've been for the past 15 months. And as we go to turning the fight towards COVID-19, it'll mean that nightclubs can reopen, casinos will reopen, and there will be new public health guidance around masks and physical distancing. Again, Dr. Henry will lay that out as the data provides over the next number of weeks. Businesses will also receive new guidelines on how they can safely operate when we move into step 3. Minister Callon will be talking about that in some detail this morning as well. We talked to his business advisory group, dozens and dozens of business operators, and we laid out this roadmap for them as well. Step 4, of course, is further down the road, and we'll leave that for another day. Today, we want to focus on steps 1 and step 2, and it's an exciting day for all of us. We have made extraordinary sacrifices as a province and as a people over the past 15 months. And nobody is more excited than the 4 of us to be moving into this reopening plan in a careful and thoughtful way, being mindful of the data, being mindful of the sacrifices so many have made to get us here. We don't want to lurch forward only to have to lurch back. Again, Dr. Henry will be talking about some of the details that give us confidence in the plan that we've laid out for you today. For people who want to return to their place of worship, but they can see that just around the corner. For people who want to see family members they haven't seen for a while, that too is just weeks away. It's good news for young people looking to get a job this summer to pay for post-secondary education or that travel year that you've wanted to take for the past 15 months. International travel will have to wait for federal direction on travel restrictions, and I look forward to those discussions with my colleagues at the Premier's table as well as with the Prime Minister. But through this all, we've had healthcare providers going to work every single day to keep us safe and to keep us well. They have made enormous sacrifices, and for that, we are in their gratitude. If we move through these steps in a thoughtful way, following the data, making sure the science directs us, I think we can get to a better place faster. But I want to reassure everyone that there is still a lot of anxiety in the community around COVID-19, and that's appropriate. This is a disease that's taken over 1,600 lives and has disrupted all of us for 15 months. And it won't disappear tomorrow. Dr. Henry will give us the details on how we will manage COVID going forward. But this restart plan, I believe, is appropriate for where we are as a province, and it's appropriate for where we are in terms of our battle with COVID-19. For the past 15 months, we've been asking you to make sacrifices. We're going to continue to ask you to make sacrifices for a few more weeks. But the light that we've been talking about for weeks and weeks now is at hand. Today, we lift the restrictions that were put in place for the circuit breaker, and we look towards mid-June to reduce further restrictions. And then by Canada Day, we can look forward to a safe and positive summer for everyone. This is a fantastic day to be in British Columbia. The weekend is past us. Case counts are going down. Vaccinations are going up. And I'm going to ask Dr. Henry to come in and give you the details on why this is such an important first step as we go towards a restart plan that's good for everybody. Dr. Henry?
Thank you very much, and good afternoon. This is indeed a good day, and one that I've been waiting for a long time, as I'm sure many people in British Columbia have too. But this plan is a careful and four-step plan to help bring us back together. Our approach, like last year's restart, is focused on protecting people and getting safely back to a more normal life. We have an important tool now, and we know how it works, we know how effective it is, and that is what is allowing us to move forward today. And that important tool is vaccines, safe and effective vaccines that are protecting people across British Columbia, across Canada, and around the world. With more and more people getting vaccinated every day, we can gradually restart our important social connections, the businesses, the activities that we have been missing for so long. From the very beginning in British Columbia, we've managed our pandemic by trying to find that balance of keeping people safe, preventing transmission, and keeping things as much open safely as we possibly can. As you know, it's been a long road to get here. We had a great restart last summer. We were able to manage with public health actions, making sure that we could manage outbreaks, but it was challenging. And as we moved into the fall, we know that cases went up and province-wide restrictions were put in place for indoor social gatherings, recognizing that this was the area where transmission was happening, and we were passing it on to those we were closest to, those we spent time with. As we moved into November, we know that hospitalizations and cases started trending up, and we needed to take additional actions to protect our healthcare system and protect those who are more likely to have severe illness or to die from COVID-19. In that case, we put more restrictions on some of the riskier indoor activities. But the other important thing that we have relied on from the very beginning of our restart last year was what we called COVID safety plans. And those were the things that allowed every individual organization, business, school to come back and ensure that they were being able to function as safely as possible. Unfortunately, when risky activities happened, we had to shut down some of those and put in more restrictions. But for us, another important milestone was December 15th, when we had our first vaccine administered here in British Columbia. As we know, After that, we were able to immunize according to our plan of those most vulnerable, most likely to have severe illness first. And by the end of February, all of our residents in long-term care and staff in long-term care were immunized. And this is when we started to learn the true power of vaccines to help us come out of this pandemic. Since we were able to protect people in those communities, outbreaks have gone down. We've still had some, but they've been milder and they haven't been as protracted or affected as many people. And this is what has helped us understand that immunization is going to be that tool that will get us out of the pandemic. And of course, we've been thinking about this for some time. A pandemic happens when we have transmission of a virus to people that are susceptible across society. Now that we have vaccines that are safe and effective, we know that we can control it now in a way that we couldn't even a few months ago. Now that we have healthcare workers, First Nations communities, Indigenous people, and those most vulnerable to severe illness protected, we can move on. But unfortunately, we had a surge in cases in March related to our third wave before we had enough people protected in our community. And that meant increased pressure on our healthcare system with our ICUs and our hospitalizations rising again in this province. And that is why we implemented the new temporary circuit breaker measures to address those areas where we saw transmission being the riskiest. Those were always meant to be temporary, and today we're in a place where we can remove those restrictions. We know here in British Columbia, across the province, people have done what we've needed to do to stop transmission, to keep our workplaces safe, to keep our families and our communities safe. And because of that, and because we've also had a dramatic increase in the supply of vaccines, we are in a different place today than we were that 6 weeks ago. We've had in the last month more British Columbians be registered and receive vaccinations in record numbers across the province, across all age groups. We're now at a point where more than 60% of us, age 18 or over, have received the first dose of vaccine. And more people are receiving their second dose. And we now, of course, know that people as young as 12 are eligible for vaccine. And I know this past weekend, a large number of young people went with their family members, with their friends, to be immunized as well. And we are starting on protecting individuals, particularly those most at risk again, with their second dose of vaccines. Vaccination is making a difference for us. We have seen our case rates come down dramatically because we've been taking these measures and because we are protecting people. When you're immunized, we know it takes time. It takes 3 weeks until you have the maximum protection from that first dose. So we have had to take time to get to the point where we are now, and we need to continue to take that time to monitor as we make changes in each step of our reopening plan. We've also seen in the last few weeks our hospitalizations coming down, the people in ICU come down, and our deaths have remained low. So this means we are in a different place now, and we have the foundations for a new restart for us here in British Columbia. Now, more than 60% of people in BC have received their first dose of vaccine, and in the next few weeks, they will be protected, both individually, but even if you do get infected, the chances of having severe illness go down dramatically, and you reduce your chances of passing it on to those you are closest to. Our 7-day rolling average of case counts has come down to the lowest place it's been for some time. Fewer people are in hospital, fewer people are in ICU, and we have a steady and reliable source of vaccine. So our focus is going to be bringing us back together gradually, keeping us safe, making sure more people continue to be immunized so that our sacrifices, small and great, are not put at risk. We also want to provide people with as much predictability as we can in the path forward, and that's in some of the details that I'm going to share with you now. As well, we will be adjusting our safety plans to make sure that businesses can continue to operate as restrictions are lifted in the coming weeks and months. We will be staying flexible because we know this virus has some tricks up its sleeve still. We will be continuing to monitor what's happening around the globe because we know that we're not all safe until everybody has been immunized, and that still is quite a challenge in many parts of the world. We'll be monitoring the data and we'll be giving dates, but this will be based on the data, not the dates, and we'll be learning as we go, as we have from the very beginning of this pandemic. So this is a summary of what we can expect to see in the next few weeks and months, our four-step process to coming out of this pandemic and learning to live with COVID-19 as just another virus that circulates in our community now and then. So today, step one on May 25th, it's based on the fact that our case rates are stable, hospitalization rates are stable and coming down, and that we have at least 60% of the population immunized. So this immunization rate is not a target for our program, which of course is everybody being immunized, and we want to continue with encouraging and making sure everybody has that access and opportunity to be immunized. But this is a minimal level that we feel in public health that it's safe for us to remove some restrictions and to monitor over time. We will continue to have masks being mandatory in indoor public spaces as we have for a number of months. We will need to continue with physical distancing and making sure that we are keeping our distance from others and making sure we're staying home if we're sick, getting tested, and making sure public health has the ability to do case management, contact tracing, as we have been doing. And I'm going to go through each of these different sectors in some detail. When we get to step two, in the next 3 weeks, we'll be watching very carefully as people's immunity builds and as we continue to stop transmission in our communities. By the earliest date of June 15th, we should be ready to move to step two. We'll continue to watch if cases are coming down, hospitalizations are coming down, and a minimum of 65% of us have been immunized against COVID-19. And in that case, we will continue to require masks in certain situations, as well as our physical distancing and that important part of us staying home and making sure we're staying away from others if we're sick ourselves. But we'll be able to increase the things that we can do both in our community, in our social gatherings, in our social lives, and in our business sector. If we continue on the same trajectory that we are, and we have low and declining case rates and hospitalizations, and at least 70% of us are immunized, we're going to get to that place by the earliest, July 1st, where we will no longer need to have the restrictions of the pandemic on our society, and we'll be able to move to having masks what they were when we had low case rates years ago it feels like, where we choose to wear masks in those situations where it's important, where we have careful social contact, recognizing that everybody's risk is different, and some people may choose to continue to take personal precautions and measures. And we need to continue to remember to stay home and stay away from others if we're sick and get tested. Finally, as we move through the summer, we'll be able to get to step 4, which we expect at the earliest will be in September 7th. And by then, masks will be a personal choice. There may be some situations during the fall when we go into respiratory season where we have clusters of cases of respiratory illness, and masks will be important again. We'll be able to have more normal social contact, but again, remembering those important things that we do as individuals to stay away from others if we're feeling sick, to clean our hands regularly, and to get tested if we need. So moving forward through these steps, the progress that we'll be looking at, really importantly, are COVID-19 case counts and trends, our immunization rates for 18 plus and for younger people as vaccines become available for them, hospitalizations, including critical care in our ICUs, and of course, mortality. But increasing the protection of people in our community through immunizations will be the central part of moving us forward to the end of this pandemic. Keeping each other safe is the focus of what we need to do, particularly in the next few weeks. This is our bridging period where we are still in a place where we have a lot of transmission in our communities. We still have clusters. We still have outbreaks that are happening, but we can manage them together as more and more people become protected through immunization. So getting vaccinated, supporting your friends, your family, your community to be immunized is something we all need to do. Right now, following the mask guidance that we have had in place is something we all need to do. You need to stay home and get tested if you're sick. We need to continue to follow our COVID safety plans in all of those aspects of our life, whether it's when we're going to a restaurant, whether it's in our business or in our recreation and places that we're going to visit. As always, it's safer outdoors versus indoors. We know this virus can transmit more easily when we're together in an indoor space where ventilation isn't very good, if we're close to others, talking loudly, singing. So those are the things that we need to postpone till later on in the restart. As well, we need to be mindful and considerate of other people's situations. If you're somebody who's immune compromised, who's older, who's going through cancer treatments, your tolerance for being around other people, for taking some of these risks right now may be lower. And there are communities in our province who are not yet ready to welcome others into the community and are taking measures to protect their community, and we need to respect that. So what does this mean? We've broken it down into several different areas of our life. So if we talk about personal gatherings, right now we've had restrictions on the number of people that can come into our home. As of today, our outdoor personal gatherings continue of up to 10 people. We know that outdoors is safer. And those people that you are close to, that same group of 10 people. So you know if you need to wear masks, if some people are more or less comfortable being together outside. But also today, indoor personal gatherings of up to 5 visitors, similar to what we did in vacation settings last summer, or one other household. So this is the opportunity to start expanding our bubble, to have one other group of people in our homes and without the restrictions that we've had in the past. And this is where wearing masks in your home is something that will be personal choice. You know if you've been immunized, you know if you're feeling more or less at risk. And these are things that you can do with a small group of people today. As of June 15th, the earliest, so in our next step, we'll be having outdoor gatherings of up to 50 people. So that means larger things, an outdoor wedding, some place where you can get together with a larger group of people. So maybe an annual block party. Indoor personal gatherings will continue with that small group of people that you're closest to. And then as we move into July, we'll be looking at having usual indoor or outdoor gatherings in personal settings. And by September, back to our normal social contact that so many of us have been craving for so long. If we look at organized gatherings, the risk is slightly different. This is where you have people coming together from different households, so we need to have more structure in place because you may not know the circumstances of everybody in that setting or in that event. So this is the time where we can have indoor, seated, organized gatherings of up to 10 people, so small indoor groups as of today. Outdoor, seated, organized gatherings, so that's where you're not dancing and mingling together, but having a small wedding with 50 people outdoors with a safety plan. And I've been working, thanks to the many faith leaders across this province, and we've developed a plan for safely coming together again for those important faith-based services that will be happening starting this week as well. Once we get to step 2 in June, we'll be increasing the number of people who can be in indoor seated environments. And this is when we expect to see things like theaters and movie houses being open again to allow people to safely, with a safety plan, come together and watch a movie. As well, we'll be starting that consultations with sectors to make sure that we can adapt the COVID safety plans to be to adjust as we move through the steps, so that by July we can have increased capacity, and that will look different for us. We can have organized gatherings with a safety plan, both indoors and outdoors, with much larger capacity. And in the summer, we can have fairs, and festivals with COVID safety plans in place to make sure that we can do that safely through the summer. And then finally, once we get to September, if the data still shows that we're on the right track, we can have larger gatherings where we can have audiences. So a rock concert, or hopefully watching the Canucks maybe even get into the playoffs next year. In terms of travel, right now, we still are going to have our zones within the province, but we invite people starting today to explore within those zones. Go camping within the area that you live. But we want to protect those areas that have less transmission and make sure that we're not spreading the virus that is still circulating right now. As we get into the middle of June, if things are going in the right direction, we'll be able to open up BC to BC. And I encourage everybody to book a week-long event, go explore British Columbia with your family, with your friends for a week in June. As we go into July, we expect that we'll be able to welcome people from other parts of Canada, even though we know that we're at different places in the pandemic and that transmission may be higher in other parts of the country. We have enough protection here that we can do that with safety plans here. And we can go visit others in other parts of the country and maybe international travel. We don't have that up here in detail because so much of that depends on what's happening around the globe, and it will depend on our work with our federal counterparts as well about how we can bring back international travel safely. Finally, in terms of sports and activities, as of today, the low-intensity indoor fitness classes that were suspended in the circuit breaker are ready again. So go to that yoga class or that Pilates class that you've been missing for the last few weeks. As well, we are going to be restarting outdoor team sports, not just for children, but also for adults. So those soccer games that we've been missing, we're now able to play games, although we won't be traveling. It will be local games for all ages and with no spectators in this bridging period right now. And when we get to June, if things continue as we expect in the right direction, we'll be looking at high-intensity indoor fitness classes being open again, indoor team games being open again without spectators, and limited numbers of outdoor spectators at games. So this means we'll be moving forward once again in alignment with the Via Sport guidelines that we've been working on together over the last number of months. By the time we get to July, we should be in a place where all of the indoor fitness classes can be increased in capacity, and we can have spectators at indoor events as well. So that's when you can go to a drop-in fitness class, perhaps. And finally, by September, we should be in the place where we can have indoor spectators, outdoor spectators, and return of normal sports competitions with those important safety plans in place. So this is the vision that we are seeing for the next little while. And there are a number of different aspects around businesses that I'm going to turn over to Minister Callon to walk through with you. I'm excited and confident that we in BC have taken the steps that we need to get to a place where we can see the end of this pandemic. That light at the end of the tunnel is getting closer, and it's getting stronger and brighter.
Thank you, Dr. Henry, and I'm Ravi Kahlon, BC's Minister for Jobs, Economic Recovery and Innovation, and today is an exciting milestone for all of us. We've banded together unlike any other time in BC's history, and this has been an extremely challenging 15 months, but our joint efforts are paying off. As you have heard today, we are now in a position to begin our four-step restart plan, thanks to the efforts of British Columbians. I want to share what BC's restart means for BC businesses and for people. For step 1 and step 2, most businesses will be able to return to operating under their new WorkSafeBC COVID safety plans. This means that beginning today, you can support your local restaurants, bars, breweries, and dine indoors, outdoors, with up to 6 friends. In step 2, banquet halls reopen with limited capacity and with safety plans in place. As well, in step 2, the restrictions on liquor services past 10 p.m. will be lifted to allow services until midnight. That is how we will operate until it is safe to move to step 3, step 4 of our restart plan, where our businesses will operate under new sector safety plans, and we will see bingo halls, casinos, nightclubs reopen with limited capacity. For offices and workplaces, step 1 allows for the work from home guidance to be lifted gradually. At this time, employees can now work in the office for a few days a week following their employer's existing safety plan. In step 2, employees can return to work fully with the ability to hold small in-person meetings. And in step 3, we will see workplaces holding larger meetings, seminars outside of the office. And as we head towards the fall and in step 4, I know many will also share in our excitement that very soon you will be able to start planning that holiday office party that we're all looking forward to do. Beginning in the early part of June, as we progress towards step 3, we will engage with businesses, stakeholders, workers, and communities. We want your input to help develop guidance for the update of specific protocols for each sector and for the next phases of the restart plan. These new guidelines will allow increased capacity, decreased administrative and physical barrier requirements, while continuing to keep everyone safe. As noted in this slide, in 2020, WorkSafeBC did a lot of direct engagement with businesses. That work will continue as a cross-government initiative. Every step of the restart plan, WorkSafeBC and public health COVID safety plans will be a cornerstone. Our safety guidelines and workplace safety plans will also be updated through consultation as we move through the steps of the restart. Businesses and organizations not directly impacted by the changes listed in the restart plan will continue to follow COVID-19 safety plans they have in place right now. In the days ahead, our government will begin reaching out to businesses, industry groups, labor groups to begin this important work. We've been through a lot together. As Minister responsible for jobs, economic recovery, and innovation, I have witnessed BC businesses adapting and innovating, going above and beyond to serve their communities and keep their workers employed. And I want to speak directly to the business community throughout BC. I want to say thank you. You have made unmeasurable sacrifices in so many ways and have worked endlessly to keep your workers and customers safe. Because of all British Columbians banding together, we're able to bend this curve. And I would like to thank everyone for their selfless acts and taking care of each other. Thank you to those who have registered, booked, and have been vaccinated, and to those on the front line administering vaccinations. This restart plan is good news for all British Columbians. It will mean more people will be able to get back to work and more businesses coming through your front door. While there are more steps ahead of us, we're headed in the right direction. Businesses need all the support they can get to help restore the economy. So with safety protocols in mind, head back to your local business. Do some in-person shopping. Have lunch with a few friends at your favorite restaurant. I know that's something I'm looking forward to doing. With each step we take, our focus will remain in protecting British Columbians. We want to ensure that sacrifices that we have made are not put at risk. More and more British Columbians are being vaccinated and doing their part to reduce transmissions. Your actions will make a difference through every step of the restart plan. While the pandemic has impacted everyone, British Columbians are resilient and determined. We look forward to the restart plan taking us toward a better future with meaningful jobs, a more innovative, sustainable, and inclusive economy for all. Before I pass on to Minister Dix, I'd like to take a moment and remember George Floyd, as today marks the anniversary of his murder. My thoughts are with his family, his community of friends, and his supporters. His death and the death of many others that we've seen in the last year are a stark reminder that systemic racism and discrimination that racialized people continue to be faced today. With that, I'll pass to Minister Dix.
Thank you, Minister Callon. Thank you, Premier. Thank you, Dr. Henry. Today's announcement is, of course, welcome news for all of us, and it reflects really all of our work together, all of you out there who have contributed to limiting transmission of COVID-19 over the last many months, indeed more than a year now, and in the recent days as well, and to all of those who've gone out and got vaccinated. Right now, the vaccination numbers are good. 2,778,907 people have received their first dose. 2,927,487 doses. 148,580 second doses. This has been and is an extraordinary effort. And what I think as we lay forward this plan, which will take us step by step towards, I think, a brighter future for our province, I just wanted to express a sense of gratitude to everyone who has come together in this time. I am very proud to be Minister of Health in British Columbia, very proud of our healthcare teams. It starts with Dr. Bonnie Henry, I think, and our whole public health teams. And I think Dr. Henry, who demonstrates both publicly and in private the kind of approach that we've taken of being kind, of being calm, being safe. That is reflected, I think she would agree, in teams around the province and in the First Nations Health Authority, who I think have taken up that mantle and have gone towards difficult times and towards trouble to help people. And all of the people who work in acute care and long-term care and assisted living and in the community, doctors and nurses and health sciences professionals, healthcare workers, the people who keep our hospitals clean and safe. And I think personally of the people who work in our grocery stores, and I know many people feel that way towards our education professionals, our frontline workers, everyone in our province. This has truly been, to date, a team effort. And of course, there is much more to do. But I just wanted to express my gratitude to all of us, all of you, for doing that, for being involved in all of that, engaging and supporting one another. It is an extraordinary achievement. I want to thank one last group of people, the people who have supported one another in difficult times, who have allowed people to self-isolate, who have got groceries and supported people and kept spirits up in difficult times. That is all of you out there. All of us have a reason, I think, to want a better future, and all of us have a reason to want to get vaccinated. So I want to encourage everyone today, because we see the numbers are good, but they can be better. If you haven't registered, to register at the Get Vaccinated website, to call 1-833-838-2323 and get vaccinated if you don't want to go through the website. But get registered, get booked, and get vaccinated now. This is the time to do it today. If you know someone, a family member, a coworker who is not yet registered, help them get registered and encourage them to do that, because that allows us to move forward to a better future. I want to say that it's getting vaccinated, and remember, get vaccinated, that means register, book, and go and get vaccinated, is critically important, and we must continue to follow public health guidance and public health orders even as they change. I know it has been a long time, but that's the reality. If we keep doing what is right, what we know is right, and we make sure to get our vaccination, days like today are the clearest, safest, and best path to the future we've been hoping for. And that future is when we're building moment by moment, day by day. Thank you very much, and I want to welcome the Premier back to the podium to take questions.
Thank you, Minister Dix, Minister Callon, Dr. Henry. It is indeed a very positive day for all of us and for all British Columbians, and I look forward to any questions the media may have. I'm sure that we've exhausted all of those possibilities in this presentation, but there might be one or two outstanding.
Thank you. As a reminder to everybody on the phone line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. First question today is from Vaughn Palmer, Vancouver Sun.
Good day. I have a question for Dr. Henry. The restart plan, as I read it, the key data that you're quoting in there is first dose vaccination. So when you talk about 60% or 65% or 70%, I wanted to ask you about this story out of Public Health England regarding the B.1.617.2 variant, which is more transmissible. As I understand the study as it's been reported, it says the Pfizer vaccine offers high protection, 88% against that variant, providing it's both doses, 2 doses. Given the low number of second doses here in BC, does that give you any pause about us basing our restart plan on first doses when that UK study suggests before you can be protected against the B1617.2, you need 2 doses?
Yeah, so obviously the different strains of the virus are something we watch really carefully, and that information is posted on the BC CDC website. As you know, we've had, I think we're up to about 500 people who've been infected with one of those strains. So yes, it of course concerns us. We're watching that carefully, but we also need to know that the measures we take to reduce transmission work against all of these variants of concern, all of the strains that are circulating in our community. So the decreasing case rates and the importance of taking those preventive measures right now more than ever continue to be part of the plan. And that's why we're going slowly. So yes, for all strains, having 2 doses gives us greater personal protection. But more importantly is the overall protection we have in the community. And we've shown that for all strains, all transmission, having everybody with a single dose is the most important single factor to get us to reducing community transmission overall. And then we need to boost everybody's individual protection with the second dose, starting with those who are more likely to have severe illness or death from COVID-19. And we are moving up the second dose for everybody, but particularly for people who are older, people who are have immune compromising conditions, people who are on a clinically extremely vulnerable list. And that is happening later this week as we're able to get more vaccine in and getting people moved up on those lists. So it is a combination of those things. It's not one or the other, but we do look at the data overall, and yes, we believe that having that minimum level of protection in adults in the province is the one single factor accompanying with all of the other data that we're using that will help us remove those restrictions that are most severely impacting us both socially and in the economic sense. So it is absolutely, again, finding that balance and paying attention to all of the different variables. And that's why I say it's not going to be by dates, it's going to be by data that's helping us make sure that we're doing the right thing. So if we start to see, for example, in the next few weeks, that cases are increasing for some specific reason, and we need to get more dose 2s in before we move to the next step, then we'll slow down our process, and we're doing that. But I think we are confident from a public health perspective that we have the tools in place right now that will safely get us through this next few weeks and months.
Vaughn, do you have a follow-up?
Yes, please. Thanks for that answer. And could you, Dr. Henry, if to the degree you can, tell British Columbians when and what they can expect to need a vaccine passport for, and what it is not likely to be required for? And we've heard international travel, but we've also heard suggestions domestic travel or going into stores in British Columbia. Do you have a clear sense of when it's likely to be required and when it's not likely to be required?
Yeah, so this is something that obviously I've been paying a lot of attention to, been working with Jay Clark and his team at the Ombudsperson to make sure that it goes back to some of the things that we've seen, Minister Callon mentioned as well, that this virus has shown us that there are inequities in our society that have been exacerbated by this pandemic. And there is no way that we will recommend inequities be increased by use of things like vaccine passports for services, for public access here in British Columbia. And that's my advice, and I've got support from the Premier, and I have talked about this, Minister Dix and others. I do think it will be something that will be necessary to support international travel, and that is something we're working with our colleagues in the Public Health Agency and at the federal level to make sure that Canadians have access to travel in the same way that other countries do as well. But it would not be my advice that we have any sort of vaccine passport within British Columbia for services in BC.
Next question is from Richard Zussman, Global News.
Part of this obviously is about looking forward, but what's being built into this plan about going back? Like if we don't hit the specific criteria, could there be parts of the plan that move forward and others remain? Or is step one, step two, and they all go in conjunction together based on that criteria?
I see it, and it's not just my plan. Obviously, there's been a lot of us who've been talking and thinking through this in the last few weeks and months, and it is a plan to go forward. We may need to slow down how we go forward depending on what happens, and we've had challenges where there's been more transmissible viruses, strains that have been circulating, but we're confident that we will continue to be able to move forward. And that's why we said earliest possible dates. We need to have a period of time of measuring. So we have some criteria. We're reducing some of the restrictions that have been most restrictive in a number of different areas. And then we need to watch and make sure that we're not seeing concerning signs or concerning outbreaks, clusters happen. But we have to remember as well that this is based on basic public health work that we do all the time. So it's going back to the place where we have enough people protected that public health can manage clusters and outbreak as they arise, like we do for many other communicable diseases. So there will be some things that will never change. Things like staying away from others if you're ill, taking those extra measures like wearing masks in those circumstances where we're in close contact with others, particularly right now where we still have a lot of unknowns, cleaning our hands regularly, and making sure that public health has the capacity to monitor cases and contacts over time. So those are the things that will allow us to keep moving forward. Yes, there are things that we can't plan for that may mean we need to slow things down, but I don't see a situation where we're going backwards unless things change very dramatically. So I guess I never say never, but the plan is to keep moving forward, but we may need to slow down.
Richard, do you have a follow-up?
I do, just about vaccination. So obviously vaccine rates is crucial here. Are we concerned about a shortage of Moderna in terms of getting second doses to those who need Moderna? And is there any guidance around changing the gap between first and second doses for Pfizer, considering it continues to be our workhorse?
Yeah, so we are reducing the gap for second doses, the interval for everybody, now that we have more vaccine supply. But it is a balancing because there's some good data that's come out recently that's shown that especially in older people, extending that interval to 3 months meant they had a stronger immune response, a better immune response. So we want to make sure we're not giving it too soon. And, for those who are following immunization and immunology like we have very closely, it's likely that 4 weeks is probably too soon. So we want to give enough time so that the immune system can have an optimal response. But we will be moving things up. And yes, it is a concern about Moderna. But we do have, we've been working with the National Advisory Committee, and the recommendations about the being able to provide a second dose with the same platform, so a messenger RNA vaccine, gives us the flexibility. And this is because we now have safety data for many, many months. So we know that people who got Moderna first can get a second dose of Pfizer if needed. So we will be looking at whether we need to do that, given the changing schedule still with Moderna vaccines. And there may be a gap, certainly in the next couple of weeks, where we're hearing that we might not get a next shipment of Moderna until later in June. So we will be providing more details about that in the next few days. Did you have?
Yeah, just with respect to Richard's first question about the pace with which we'll move with the restart plan, I want to put some context on where we are here in British Columbia. We've just passed the May long weekend. We're days away from June, weeks away from July. And there have been some in the community who have said, we need to know right now where we're going and how we're going to get there. And then there's a whole bunch of other people, the overwhelming majority, who have been saying, how can we safely continue to hang together, as Minister Dix said, as Dr. Henry has said, for months and months and months. And we put together this plan across government on the advice of public health, on the advice of the Ministry of Health in terms of capacity in our healthcare, our acute care system. And we're confident that we are in a positive place to put in these steps forward in a measured way based on data. And I just want to reinforce that for British Columbians. There are going to be a lot of people who are anxious. I would suspect that Vaughn's question speaks to that there are people who are concerned that we may go too fast. And we've tried to balance throughout this ordeal, how can we best represent people's needs at a government level, within the economy, within our healthcare system. And we are very confident that we have waited to the appropriate time to lay out a 4-step plan to get us back to where we all want to be. I'm very confident that if there is anything we've learned from COVID-19, it's to expect the unexpected. And Dr. Henry and her team are watching every minute of every day, international events here in British Columbia, to make sure we're as advised as we possibly can be about the risks. And then it falls to us as government to weigh those risks, to engage with the public. Minister Callon's industry engagement team, there's some 70 different organizations from business to labor, community groups, not-for-profits, Indigenous groups, who come together every week or two to hash these things out, to make sure that we're going in a measured way so that we can have a positive outcome. Going forward and then slamming back again is not what we want to do. We've seen that in other jurisdictions. We're confident that Dr. Henry has given us the map. Vaccinations, as Minister Dix has said, is our key to success. If you haven't registered, go do so today.
Bender Sajan, CTV.
Hi there. I'm just wondering what this means for enforcement. So can we still expect to see road checks, travel checks happening on highways? Will BC Ferry still be asking passengers if their travel is for essential reasons? Are we still going to see police handing out fines for people who are having parties in the next little while? And how long would that continue?
The travel restrictions within regions remain in place. What we have lifted is the advice, which Minister Dix, Dr. Henry, and I have been saying repeatedly, stay close to home. Now you need to stay within your region. So if you live on Vancouver Island, Vancouver Island is your region. If you live in the north or in the interior, virtually all of British Columbia is available to you to travel within. Again, using common sense, checking before you go where you're arriving and whether you'll be welcomed and if there's space for you and all of those issues, which people have to do in a pandemic or outside of a pandemic. And in terms of enforcement, the travel restrictions are in place. It's our expectation, Minister Farnworth will be talking about this in more depth throughout the week, that enforcement will remain in place. With respect to gatherings, we have relieved the restrictions on gatherings, but not letting it all rip. And if we find that there are parties of 50 or more that are taking place before we get to the next step, you can expect law enforcement will be there to give you a bit of a present to start on your second step.
Follow-up, Bender?
Yes, and this one's for Dr. Henry. Some people were able to book their second doses in the last 24 hours because they were told that the gap between Pfizer doses was now 50 days. And I know you mentioned some of that's coming later this week, but the news spread quickly and some people were able to book a second vaccine. Some people weren't able to. Can you let us know what happened and why could some book a second dose early while others couldn't?
Yeah, so we are, as I mentioned last week, we're looking at the amount of vaccine we have coming in, and we need to reprogram our system to send out the automatic bookings. And they were doing that over the weekend, and they did have a glitch where invitations went out to a certain number of people for a very short period of time. Rest assured, we are fixing it all, and so we are honoring those appointments that people already made, but we will be sending out appointments in a structured way starting later this week, and we'll provide you with all of those details. But yes, everybody will be moved up Those appointments will be coming available. We'll be getting second doses into people quickly as the vaccine supply has come in. And as we've been talking about just a bit earlier, making sure that we have provisions for Moderna for those who've received Moderna, and being able to interchange both Pfizer and Moderna if needed. I will also say that we're continuing to wait on data to give best advice about what people who received AstraZeneca should do for their second dose, and we'll have that information, I'm thinking, early next week. We have meetings with our counterparts in the UK around some of the important studies that are that have been done there. So we'll have more information and advice for people to make their decisions around AstraZeneca early next week. So just hold tight. We are making sure that second dose invitations for those who receive their vaccine first, particularly in March and April, people who are in the clinically extremely vulnerable group, you will start to receive those very soon, and I'll have more details for how that's all going to work for people on Thursday.
Next question is from Tanya Fletcher, CBC.
Oh, hi there. Talking about travel again. Now, the province was hesitant to restrict travel within BC up until last month. The ban on indoor dining expired at midnight as per the circuit breaker, but non-essential regional travel still isn't allowed. Why is that? Is it that much riskier?
You know, there are differences in transmission rates in different communities around the province. We know that the focus has been in the Lower Mainland. So that is one of the areas where we can have increased travel within those boundaries, but it is a very effective measure of stopping transmission and introductions into communities when we're not yet at that point where enough people are immunized, where our case levels are low enough. So that was the rationale around that. We know that indoor dining can happen when we're at certain levels. We know that people who work in the restaurant and food association, food businesses have been able to be immunized, and I know a lot of people have been immunized, so we have that extra layer of protection now with case rates coming down. So that's, and with the safety plans that are in place. So the traveling is another step where we know it can bring the virus into a community, and we're not there yet. I don't know, Premier, if you wanted to address that? Or? Okay.
Follow-up, Tanya?
Yes, please. And if for my colleagues, we could get a response in French from Minister Dix as well. Thank you. Can you elaborate on what normal social contact means? You mentioned in the technical briefing as well that certain activities like hugging can resume among social circles now. Can you elaborate on that guidance and whether discretion should be tied to, say, whether friends or family have been vaccinated?
Sure. And yeah, I think this is where we each have our own level of risk tolerance, and we have our own levels of vulnerability for this virus and for what we've been through in the last few months. So yes, we're saying expand your circle in a small way right now. The same group of people, the family, another family or another group of friends, but the same ones. And you can have those connections in your house, but you need to know whether they're immunized, whether you're immunized, whether I have a very good friend who's been going through cancer treatments, and we're not going to take our masks off right now because she's still vulnerable. So we have to make those decisions ourselves in the next little while. But it is those normal interactions that we're used to. So if your grandparents have been immunized and they're going to be part of your social connections again with your grandkids, yeah, you know each other, you know what the risks are. Now's the time where you can get together, you can hug again. And I'm thinking by the time we get to July, if things continue in the way that we expect, that we'll be able to hug our neighbors again, if they're people who like to be hugged. I mean, we have to understand that not everybody does, but it's one of the things that I'm missing most in this pandemic. And I've been trying to pitch to the Premier that we should have BC Hug Day in July when we get to that point where we can take our masks off and have those closer social interactions that we used to have with people that we're close to, whether that's family or friends.
Je pense que le clé pour le moment, c'est de comprendre les circonstances de vos amis, de votre famille, et d'agir selon ces circonstances. Donc, ça va être important. Et d'agir avec prudence, surtout dans les semaines à venir. Il y a quand même, hier, on a annoncé moins de 300 cas de COVID-19, mais c'est quand même 300 cas. Donc, il faut toujours suivre les conseils de la santé publique. Il faut toujours suivre les règles de la santé publique, surtout avec ceux dans notre propre cercle. Donc, ça va être possible au mois de juillet, par exemple, d'élargir le cercle. Mais pour le moment, il faut le faire prudemment et d'agir comme on veut être, de traiter les autres comme on veut être traité, avec respect, avec dignité et pendant une période de pandémie, avec prudence.
Lisa Used on News 1130.
So excited about this Hug Day idea. Okay, moving on to the business at hand. Vaccinations. Minister Dix, you said in the beginning, that the vaccination rates are good. They could be better. I'm wondering, with the supply coming, we're having 12-year-olds vaccinated. You're bumping up second doses. Why can't we have more people vaccinated? Like, if we hit the limit when we're hitting around 60,000 vaccinations a day, are we going to see these expanded so people can get in there faster? Now that you're looking at shrinking the date or the duration between at least the first two Pfizer doses, can you see more of this coming sooner?
I can. We don't have, we're receiving more vaccine every week in the coming months. Starting May 31st, we're receiving approximately 327 to 328,000 doses of Pfizer a week, and that's more than the 276,000 doses we received each week in May. So that's going to allow us to do more, and that's why you've seen us expand very quickly the eligibility for dose 1, and now it's everyone over 12. I'm happy to report that about 44% of people 12 to 17 have now registered already in the few days. That's some 137,896 people. So that's an impressive effort. But we are limited, of course, by the amount of vaccine we have, but we're confident, and you say about 50,000 to 60,000 a day during weekday. That's about the vaccine. If you think of the 328,000 doses that we receive each week, about the vaccine we're receiving. We have, as you know, there's a little bit more uncertainty around Moderna. So the reality is this, yes, we're going to be continue to vaccinate more people and to do what we've been doing. And I want to pay tribute to our team of people who have performed the vaccinations, but our whole team led by Dr. Penny Ballum, who have consistently delivered the vaccine into people's arms as it's arrived, understanding the urgency of that. And I want to encourage everyone, absolutely everyone, to register right now. This is the time. Today is the time. It's the way you can help in this pandemic. Every time someone gets vaccinated, even if we don't know them, even if we never met them, every time someone gets vaccinated in BC, it makes us all safer, which means register and get vaccinated. Yes, there'll be more vaccine, and yes, of course, increasingly as we move along, regardless of what the difference is between dose 1 and dose 2, as we move along, there'll be more people eligible for dose 2, and that will become an increasing share of our vaccination. So it's positive so far, but we need anyone out there who hasn't registered to get registered today.
Lisa, do you have a follow-up?
What is the biggest impediment to these plans, this 4-stage plan, hitting all these stages on the dates that are the most optimistic dates? What is the biggest impediment to that happening?
Well, as I said at the beginning, and Dr. Henry reinforced, it's not just dates, it's dates and data. And so we have been following the numbers, all of us in BC, and regularly tuning in to hear Minister Dix and Dr. Henry lay out the state of play on a daily basis and then on a bi-weekly basis, and hopefully as time goes by, less often. for Dr. Henry's benefit. And so what we need to do, as we've said and will continue to say, we need people to get registered and get vaccinated. The biggest route to success, or the fastest route to success, is increasing our numbers of people vaccinated with both doses as quickly as we can do that. And that's the plan. With respect to the elements of moving forward step by step, again, we're going to be monitoring activity in the marketplace, what's happening in businesses, what's happening in communities. Minister Calon and his team will be doing that. As we leave this briefing today, ministers from across government will be reaching out to their stakeholders to talk to them about what we can do to help them reduce barriers to get back into the place we were in back at the beginning of 2020. So I don't think that we're looking for impediments, quite the opposite. We're looking for ways to reduce impediments. That starts with vaccinations and really, quite frankly, ends with vaccinations, and the good sense of British Columbians who have got us to this position within Canada where we have had some of the best outcomes over the past 15 months with Wave 2, Wave 3, and now as we see the opening up plans being offered by provinces across the country, I'm confident that our plan will take us to where we need to get to, provided that everyone's on board, and I know British Columbians want to work together as we have for the past 15 months.
Next question is from Jawad Siddiqui, Connect FM.
Hi, Premier. With your confidence in the restart plan and with over 60% adult population now vaccinated, what are your expectations from people between 20 and 39, an age group that you said was putting the rest at risk by not following COVID SOPs, especially now when you say slamming back is not something you want to see?
Well, again, we're urging all British Columbians who have not yet registered to do so. And it doesn't matter what cohort you're in. If you're in your 80s and you haven't registered, you really should. If you're anywhere from 12 years old and up, you can register, you can get a booking, and you can get a vaccination. I'm confident that everybody wants, the young people want to return to pursuing their dreams, as all young people do. The rest of us want to also continue to pursue our dreams and to work with our friends and our families, to see people, to hug people that we haven't hugged in a long while. Doesn't matter how old you are. I think everybody at this stage of the pandemic is with the program. They understand the challenges and the risks. And when we find people engaging in reckless behavior, we owe it to them to let them know that and encourage them to take a different path, get vaccinated, put that mask on if you're in a larger grouping, follow the public health orders. And I was thinking as Dr. Henry was talking, my mom, if she were here today, would be so proud at the number of times I've washed my hands in the past 15 months.
Jawad, do you have a follow-up?
And so, yeah, I do. Thank you. So you did mention the last mile that you referred to in early April for protecting people from the virus. Do you think today marks the finish line for that last mile, or is that a different step of the restart plan?
Well, Dr. Henry's the runner, as is Minister Dix, a former marathoner. Ravi was an Olympian. I just played a bit of lacrosse, and I know the game's not over till it's over. And you have to play till the final horn, and we have not yet heard that horn. We're near the end, and I know we've been stretching sports metaphors for 15 months here as well. But it's true. We are so close. But it needs all of us to lean in to make sure we follow the orders that are in place. I know businesses, Minister Callan and I met with his engagement group this morning, a sense of relief that the circuit breaker worked, that the government was there for people to help them get through that with financial assistance. But more importantly, we were there to make sure we had a clear roadmap to come out of the circuit breaker and go into the summer and get back to normal. And I'm confident that to a person, British Columbians want to get there. And I am absolutely beyond confident that if we get people to register, to get a booking and get a vaccination, we will be able to have the best summer we've had in at least 15 months.
Next question is from Farhan Lalji, TSN.
To either Premier Horgan or Dr. Henry, I know that you both have mentioned the Canucks as an event that possibly fits into phase 4 of this plan. Regarding the BC Lions and the Vancouver Whitecaps, who've both been working with BC Place on return-to-play plans that could involve fans in stands, with that being a possible outdoor venue, is there a chance that their events with fans potentially fit in the later stages of stage 3, or are they also locked into stage 4?
Well, thank you very much for the question. And both Dr. Henry and I have been engaging with both the Whitecaps and the Lions. We also need to know that both of those franchises play against other teams and other cities, many of them, of course, in the case of the Lions, Canadian cities. So we need to know, of course, what's going to be happening for the Blue Bombers in Winnipeg. Manitoba's experiencing a very difficult third wave at the moment. Alberta and Ontario, both with dual franchise, well, 3 franchise in Ontario, have seen their case count starting to come down. I don't know what the state of play is there. I was very sad to learn that the Western Lacrosse Association and the Canadian Lacrosse League has canceled the Mann Cup this year because they just can't figure out how they're going to get a season in and still have a national championship in the current situation. But we've been talking to the Lions, we've been talking to the Whitecaps. I know both Dr. Henry and I are huge sports fans, and we haven't even mentioned Melanie Mark, who is all about the rugby sevens and about sports and getting people back into playing. And we're going to do everything we can to get there. But again, we'll have to leave those discussions for those franchise with public health and with the government. But I'm optimistic, Farhana, that if they can push the season further into August, we might be in a better place.
Follow-up, Farhan?
Thanks. No, I'm fine. Thank you.
Great, thank you. We have time for one more question today. Mandy Wen Fairchild. Are you there, Mandy? Somebody else. Okay, we'll take one more question. Moira Whiten, the Tyee.
Hi, thank you so much for taking my question. Following up on Vaughn's earlier question, why do we not have a threshold for the proportion of the population that has a second dose baked into this restart plan, given that there is kind of a lot of variation on effectiveness of the vaccine between first and second doses with regards to variants?
Yeah, so this is something that we've been following, of course, very closely in public health. And the strategy that we have of getting as many people as possible with a first dose has been shown both in BC with the vaccine effectiveness data that I presented last week and the breakthrough data that we presented the week before. We know in the real world effectiveness, it is getting as many people that first dose as possible that gets us to the point where we can reduce transmission in the community to the point where it's manageable and we can start lifting restrictions. So that is independent of the personal protection that we get from a second dose of vaccine. So for example, it bumps it up from about 80% to 90% vaccine effectiveness as an individual. But as a community, the most important thing is to have more people with that 80% protection. And that has shown in, we look at the UK, it's shown both for Pfizer and AstraZeneca that if you get to that level, you can reduce the probability that the virus will transmit in the community. So that's why this plan is based on the amount of community protection we have from a single dose of vaccine. It is absolutely important to have the second dose, one, so that we can have that individual protection and that extra 20% of potential risk means that we won't pass it to those that we're closest to. And if a new strain arises, we have many different strains of this virus that are being transmitted between people that we can stop by having additional personal protection for that one-on-one transmission or that transmission in an outbreak or in a small cluster. So it is important, absolutely. These are two-dose vaccines. All of the ones that we have right now, the Johnson & Johnson is a single-dose vaccine, but we don't yet have that in play here in BC. So it is important to get that second dose. And now that we have vaccine supplies, we're going to be moving up the period of time for that second dose. But as I mentioned earlier, there's also increasing data that shows that having an increased delay, so beyond the 21 to 28 days that were done in the clinical trials, does give people a stronger, more longer lasting benefit. So we don't want those doses to be too soon because we want people to get the best protection possible. So it is finding those balances. And right now, The most important thing is getting as many people as protected as possible, and then we are going to be increasing the personal protection that individuals have. So that's the understanding behind it, and why we're doing it the way we're doing it here.
Moira, do you have a follow-up?
I do, thank you. And Dr. Henry, you alluded to this earlier in your remarks, but a lot of people may be feeling anxiety, and particularly, I imagine that's the case for people who either can't get vaccinated for medical reasons or who are immunocompromised or disabled, who have increased risk of serious illness right now, say even with dose 1. What can you say to reassure them about this plan? And I don't know if you've addressed this already elsewhere, but is there an acceptable level of death that will allow this plan to go forward that is included in your metrics for success?
Yeah, no, of course, from the very beginning, everything that we've been doing is to prevent people from having severe illness and dying from COVID-19. And that continues to be the focus of what we're doing and the focus of the plan. So yes, we do need to understand that there are trade-offs that we have had. Our purpose, our goals as we've started this pandemic and as for every phase have been to stop morbidity and mortality, so sickness and death from the virus, to keep our healthcare system functioning so that people with COVID-19, but people with every other healthcare need, whether it's from a car crash or a heart attack, are able to get the care they need as well. And the third part is to minimize societal disruption. And the measures that we've put in place to accomplish the first two have caused a lot of societal disruption. And that is the part that also has impacts on people's health and wellness. So we have to balance those. And so this restart plan is a careful, slow moving plan where we minimize the morbidity and mortality, minimize as much of the transmission as we can, so that we can safely lift those restrictions that also have impacts on people's health and wellness in the province. So it is that balancing, trying to find that right way to support both of those things. And both of them are really important. So I can reassure people, for those of people who are immune compromised, who are going through things like cancer treatment, you will get your second dose, but even that is not going to protect you 100%, and you will need to keep taking precautions to protect yourself, protect those around you. And we all need to be mindful and respectful of that, because not everybody is in the same boat, as we've been saying from the very beginning of this storm. And we are going into a new place where we'll have to tread cautiously when there's some communities that are not yet ready to welcome visitors. We saw that last summer, and we'll see that again this year. It will take slower amount of time. It may be slower for some communities, certainly slower for some individuals to get to a place where they're comfortable with not taking the individual and the community precautions that we have in place right now. I will say, though, that some people are probably quite happy to, and it's going to be awkward. I mean, how many of us have watched a movie where people are getting together and doing things and cringing a little bit? So all of us are going to have to carefully and slowly and respectfully move through that. And I will put out a little challenge for my nieces and nephews, though, that I will be hugging you, so beware.
That's all the time we have today. Thank you, everybody.
There you have it, everyone. We've been watching